go.
So today we're going to be doing some cervical traction on a 42-year-old male patient who has a C5, C6 disc herniation. That's why we're going to be doing the cervical traction, and we're also going to be doing sustained traction, so that'll hopefully help reduce some of his neck pain. Some of the indications of doing the cervical traction is for reduction of like a disc herniation, and also to kind of increase that joint space, and also reduction of pain. And then also like contraindications for doing this traction would be if he has some peripheralization of his symptoms down into his arms, if he's had surgery recently, either for like stabilization or any inserts put in, and then also if he's had any like acute injuries like a sprain or a strain, and then also like acute inflammation. So how you doing, Zach?
Good.
We're going to be doing some traction on your neck.
Okay.
I just want to ask you a few questions real quick. Have you had any surgeries on your neck or spine?
Nope.
Nothing? Okay.
Nope.
What about, have you had any injuries recently that would have caused you like to have inflammation or anything else that's happened recently?
Nope.
Okay. And then I just want to explain to you real quickly what kind of the purpose of this is and why we're going to be doing this. And then also I just want to clarify like your cognition. So do you know what today is?
Today's Monday.
Okay. And then what about, do you have any like impaired sensation? Like, can you kind of feel me touching the side of your head?
Yeah.
Does that feel okay? All right. For this, I'm going to have you remove your glasses.
Okay.
And then, like I said, the reason we're doing this cervical traction is to increase the joint space in between your vertebrae and your neck. And then also because you have that disc herniation, we're wanting to try and kind of encourage that disc to kind of reduce the pressure on your nerves. And that's kind of like the purpose of this, okay?
Okay.
So what I want to do is we want to get these pads kind of positioned on the bony prominences on the low back side of your head. Do you feel like that's kind of where they're positioned height-wise?
Yeah, height-wise, I think it's
Okay.
good.
Do you want them a little bit tighter?
I think it could be tighter.
Okay, go ahead and let me know when. We're going to just tighten these until we're snug.
Probably right there.
Right there?
Yeah.
Okay. Then I'm going to put this pillowcase on your forehead just so that we can kind of create some separation between the strap here and your forehead. And then I'll just tighten this down. And we want this snug, but not like super tight where it's uncomfortable. So, how's that feel?
Yeah, that's
feel
good.
Okay? Okay. And then before we even start turning the traction on or anything, I'm going to give you this kill switch.
Okay.
When we do the traction, I want you to push that if it gets uncomfortable or you have any like peripheralization or like pain moving down into your arms and stuff like that, okay?
Okay.
And then it'll relieve the pressure, okay?
Okay.
Sound good? Are you comfortable where you're at?
Yeah.
Okay. Let me get this hooked up on here. So we're doing sustained traction on Zach's neck. So we're gonna click on traction, and we're gonna click on cervical. We're doing it for a disc herniation, and I'm gonna input my stuff manually. Even though this is the first time, we know that Zach responds well to traction. So we're gonna do about 10 to 20 minutes, so we'll stick with 15, and then we're gonna do about 10 to 20 pounds worth of pressure. Zach, I'm gonna start turning this up, so you're gonna start feeling a little bit of a pull.
Okay.
And we'll go slow. Oh, looks like I bumped a button. You feel okay?
Yep.
Okay. Just go up to 15. Click start. And like I said, we're doing sustained traction. Is that feeling okay still?
Yep.
Okay. We'll just periodically check on him, make sure that he's not having any discomfort. Is that relieving some of the pain in your neck?
Oh yeah.
Okay, good. Let it run for a bit. And then we can either, if we were to stop early, in this case we will, we can either have them push the kill switch or we can just press stop and it'll reset and slowly relieve Is all that pressure relieved?
Yep.
Okay. I'll go ahead and unhook this. Lunge that. I'm trying to be gentle, so not jarring your head too much. We'll make sure the skin's not irritated, both on his forehead and then also on the sides of his head. And then when we go ahead and sit up, we want to take it slow. So go ahead and take your time. I don't want you to be too aggressive when you go to sit up. You can just come to this right side of the table. Good. Okay. You okay?
Yeah.
Alrighty.